Hi everybody, welcome back to our fitness session with Lindsay. I know that many of you are now following the exercises that we're posting here. Some of you have even got your husbands enrolled, which is fantastic. Well done you. And I hope that we're building for you a nice comprehensive range of exercises which will see you far into the future, into a fitter and altogether I don't know, more toned up future if you keep on doing the exercises. So what we're going to do today is something really important, and that is balance. Now, why is balance important? Well, one of the big bugbears, I think, of a lot of older people is the fear of falling over, because they kind of know that it's the beginning of the end. Once you start falling over and you've no longer got that really good balance that younger people have, then you're vulnerable to all sorts of things. You're obviously more vulnerable to injury, but you're probably more vulnerable to not being able to live alone. Because, you know, who can live alone with the danger of falling over and not being discovered? So, you know, there's all sorts of horrors within that. So to avoid that, what you need to do is to practice your balancing and to actually get better at it. And that's what we're going to show you how to do today. I've been really impressed over the 3 years that I've been working with Lindsay at how much my balance has improved. So, you know, it's something that I definitely know that you can make a big difference to. So I'm going to hand over to Lindsay now, who's going to talk you through what we're going to be doing here, and then we'll show you a practical demonstration of the exercises. Okay, so over to you, Lindsay.
Well done on your progress so far and all the lovely comments. That's absolutely fantastic. So today we have got a slightly less vigorous session than the one we had last week, which you might say, hurrah, I don't know. But it's no less important, as Tricia said. So balance. Balance is defined as the body's ability to hold its position. So whether it's static or moving, it's the body's ability to hold and control that position. So if you think about it, there's pretty much every situation in life, the body has got to hold itself in one position or another. So if we're walking, there's an element of balance. Even day-to-day tasks have been around the house. You know, if you think about putting something up onto a shelf and you go onto your tiptoes, there's balance there. Lots and lots of different sports and activity. Balance is really, really important. And so it's not just for people as you get older that it's important to train balance, but for everybody, to be honest. And increasingly athletes are including that kind of training in their programs as well. Obviously, as you get older, bones become more brittle, and so it's even more important that your balance is good, because otherwise you risk tripping, falling, and then all the injuries that ensue, as Tricia says. And it's been really interesting, as you say, Tricia, because you've had a couple of incidents, I think you might have even mentioned in the first session that we did, where you almost fell, and the strength in your legs and your improved balance was able to prevent really quite serious injuries in both those situations, wasn't it?
Yes, 100%. And I think it was a combination of better balance and then core strength to actually, I sort of dived out of the fall that I could feel myself going into. So instead of, you know, I was sort of falling towards the floor like that, but I took a step forward, as you do, and then I sort of came up like that, which was, you know, which was incredible. So yeah, I can thoroughly recommend the whole notion of improving your balance. Unquestionably important thing to do.
Yeah, absolutely. And for those of you that have perhaps not read around balance and balance systems, let's just talk very briefly about how balance works. So it basically comes from the inner ear, the vestibular system in the inner ear, the eyes, and then the muscles, joints, tendons, ligaments, which I should say, have all got receptors on them. And those three areas, so the eyes, the ears, and the various muscles and joints, feed back to the brain on a pretty permanent basis. The brain then processes that information and sends messages back to the muscles and the joints in terms of what they need to do to maintain and or correct the balance. So when we're training balance, we can look at some of those areas. So we can look at eyes, for example, and work with eyes open, eyes closed. We can look at how the muscles are function, the strength of the muscles. We can also look at the our stability, so the size of our base, and each of those things we're going to work through today with the various exercises that I'll show you. So we'll get straight into it. We'll start, I don't normally do a big warm-up with balance exercises, but I think it's always good to take the opportunity just to mobilize the joints. So we'll do a little bit of lower body mobilization, and then we'll go straight into the exercises. And today, the way I'm going to work it is I'm going to start with the easiest of the exercises and work on from there. So you can choose whether you want to do the first one, the second one, or go all the way through, but you'll see that they'll increase in difficulty as we go. So can we start, Tricia, with that mobilization that I just mentioned? So I want to just do the ankles to start off with. So if you want to hold on to the wall or a chair, please do. And if you can just point and flex your ankles, or one at a time. That's it. And then circle them around. And the other way. Good job. And then let's go to the other side. So point and flex the ankle. And give it a circle. And reverse. Perfect, good. While you're standing there, you can just swing one leg front and back. So just working into the hip. Yeah, keep quite a small range of movement for now. That's it. And then same leg comes across the front of your body. So side to side. Perfect. Now, if you put that toe down on the floor, and I just want you to rotate your knee into the center and then out to the side. That's it. Perfect. So keep the pelvis still and rotate the knee. So these are all good movements for anybody that wants to work on their hip mobility in any case. That's it. Good job. And then let's do the same thing the other side. So swing it through. And then you're going to go across the front. Keep the pelvis nice and still, lightly draw the tummy in. Perfect. And put your toe down and knee comes into the center and then out to the side, keeping the pelvis still as you do so. So we're really trying to isolate the hip joint by keeping the pelvis still and just rotating the thigh bone around in the joint. That's it. Good job. Okay. You can pop the chair to the side if you like, and then you're going to just take the feet out a little bit wider and then take your foot to your bottom. So bending at the knee, just warming up through the knee joint now. Yeah, perfect. Good. Okay, lovely. A couple of side bends. Good. And then gentle rotation. Perfect. Lovely. Okay. Right, so first exercise then, you remember I talked at the beginning about the size of the base. So if you've got your feet hip width apart, you've already got some stability going through your legs. If you put those feet together, we've narrowed the size of the base. So if you can put your feet together, Tricia, and then we're not going to have the arms helping us. So if you cross your arms over your chest and then So feet are completely together, legs are completely together, and you're just going to hold it there. So this is the easiest of the exercises that we'll do. Everybody's balance is going to be different. Some people will even find this a challenge, and that's fine. So find the level that's right for you and work with that. Now, one thing that I would say is a really good motivator with balance is to actually time yourself. So I'm not going to time Tricia today because it's actually quite hard to balance when there's lots of other things going on. But if you're doing it at home, then I would time where you're at now on each of these exercises, or the ones that you choose to do, and then time yourself again in a few weeks and see if you've got that improvement that you're looking for. So how does that feel to you, Tricia?
It feels absolutely fine. Yeah, it's not difficult for me to do this.
Okay, so your balance is generally quite good. So I wouldn't expect that one necessarily to challenge you, but what might challenge you a little bit more is if we do the same movement, but we close our eyes. So I mentioned at the beginning that the eyes are an important part of balance. And so I would imagine that if you close your eyes, Tricia, straight away, you would feel a different level of difficulty with that exercise.
Yeah, I feel a bit wobbly.
And what will happen is that wobble will just get more and more and more as you go through. One thing that I would probably recommend is that if you're not used to doing balance exercises, or you feel a bit wobbly generally, then go close to a wall or go close to a chair that you know you can grab a hold of if you do start to wobble a little bit. You still got your eyes closed?
Yeah.
So you're doing really well with that one. You can open them now. So I would expect for people doing that for the first time that the second one with your eyes closed would be much, much more of a challenge than it was with them open. Okay, so ease you in gently. We'll go now on to something that's a little bit more challenging, where we're going to start to take even more of the base away and work on one leg. So I would, again, be close to a wall if you feel like you need to. And you can do this in stages. So Tricia's used to working with one knee lifted up, but if you don't want to go to that straight away, then just work with your toe tapping down on the floor. So let's just demonstrate that, Tricia. So if you just, yeah, exactly. So what you're trying to do there is get the body used to the fact that you're about to take that base away. So that side of the leg, you're going to take it away. So this is a good halfway house to work you up to taking one leg away completely, and stabilize with your fingertips. Try not to grab onto the wall completely. Stabilize with the fingertips if you need to. Obviously don't if you don't need to. So Tricia, we're going to extend this and we're going to lift up the knee. So you'll need to stand tall, open the chest, lightly draw in the tummy, and then when you're ready, you're going to go up onto one knee and see what happens. A good tip here is to focus on a point. So I said that the eyes are important in balance. So if you can focus on one point, preferably not a point that's moving, then that is going to help you. And then you just relaxing, just breathing as normal. How does that feel, Tricia?
It feels fine. It's very, very important to fix your eyes.
Let's try the other leg and see if it's any different.
So with knee up?
I think go straight into knee up. If people want to do the one with just the toes down, then that's their option. The other thing I want to point out with this knee up one is to make sure that your hips stay level. So I sometimes like to work with my hands on my hips because I can feel what's going on in my pelvis. And what you'll find is when you take one leg away, the temptation is to slump into one side. So try and make sure that you're maintaining that alignment through the hip as you hold it there. So how did you find that compared to the other side?
I think reasonably even. It's really funny when you stand on one leg. the leg that you're standing on gets tired. I do find that, so it's quite a relief to then stand on the other leg and bring the other one up to relieve the, you know, the tight, you know, you stand on this leg actually gets quite tired. So yeah, it was fine. I mean, I didn't feel that there was a marked difference between the two.
Okay. So that's something for people to watch out for as well. If you find that there's quite a difference between the two sides, and it's very common that there could be a difference between the two sides, then that again gives you a pointer in terms of where you need to focus your energy. But for you, they're pretty even, so that's okay. I want to pick up on your point about your hips starting to feel it. And we're working on balance here, but of course, what we'll also be working on is strengthening those muscles around the hip. And the work that we did in the lower body strength exercise session will be important in developing that strength around the hip area. So it's particularly the bottom, but also for this, those muscles at the side of the hip, still part of the glute, the bottom series, but they support the side of the hip, and those are the ones that are going to stop you slumping to one side. And if you can strengthen those muscles, then they're the ones that are going to stop your leg aching when you do the balance work like we're doing at the moment. So I would say the same thing again with regard to this particular exercise. The next step on would be to do the same exercise, but actually do it with your eyes closed. And it's really hard. So let's have a little go, Tricia, and see how much of a difference it makes.
I'm not even sure I can do it with my eyes closed, actually, Lindsay, to be honest with you.
Why don't you stand reasonably close to the wall and put your fingertips near the wall?
I'll tell you what, I'll do the chair.
Or the chair. So really try not to rely on it as much as you can.
Okay,
well done.
Just having a fingertip makes all the difference. It's really weird. It's a very, very weird sensation, because I can honestly say as soon as I close my eyes, I tend to not be able to do anything. But I think just having my fingertip on there just makes me feel like there is some level of security.
Yes.
I'm definitely not holding on, but it's just pinning me somehow.
Yeah. So I would really encourage people to have something there, particularly if you're doing these kind of exercises for the first time. It's just really important that you know that you can grab onto something should you need to. Do you want to try the other side?
Yeah. So as soon as I take my hand away, I can really feel myself just starting to lose it.
Yeah. But good. And if you practice that on a regular basis, then you'd build this up. The other good thing about these kind of exercises is you can do them anytime, anywhere. So you don't have to be in this kind of exercise type environment to do them. Think of what I always recommend to the ladies that I work with that want to work on their balance, is that they link it to something that they do every day. So that something could be brushing your teeth, it could be while you're waiting for the dinner to cook, any kind of situation that you're going to be in a position where you could take one leg off and hold it and get some practice in that way, just so that you're doing it regularly, and you'll see the difference.
I've actually got an electric toothbrush that has 30-second timers on it, so it's 2 minutes long, and it has buzzes after 30 seconds, and it's really good using that, because I can do it on one leg and do it for 30 seconds or 60 seconds and then go on to the other leg, and it actually times it. So if you have an electric toothbrush like that, it can be a very good way to practice your balancing. That's
a really good idea. So what I want to do now is to progress that concept a little bit further and add some movement into it. So we've tried it just on its own with the knee up. We've tried it with the eyes closed. Let's now try and add some movement in and see what happens. So when you're ready, you're going to stand tall again. Make sure your shoulders are relaxed, lightly draw in your tummy, and then you're going to lift one leg. So your knees coming to about hip height, that's right. Now you're going to hold it there and you're going to extend the leg out straight to the front. Good. And then back in. And extend. And release. Looking good. Extend. And release. Perfect. So you would do as many of these as you can do before you wobble over. Yeah, that looks really nice and stable. There you go. Perfect. Let's just do some on the other side then. We're even. So you're making sure that your hips are level, so you're not dropping down to one side. The other thing to make sure when you're working on one leg is that you're not locked out at the knee. So you want, it's not a bent knee, but it's just not locked. So just slightly soft. Good. Perfect. Good. Okay, I'm going to do one more along those lines and then we'll move on. So we're going to lift up the knee. This time you're going to keep it bent, but you're going to take it out to the side and back in. So for this, you need to hold your pelvis still. That's it. Out and in. Perfect. Out and in. So the pelvis stays completely still, which will restrict your range of movement with the leg. And I would say that this one is slightly harder than the last one. What do you think, Tricia?
Yeah, it's definitely harder because when you switch your knee to the side, you throw the balance off.
Yeah, exactly.
You can feel your body having to compensate for the fact that you're unbalancing yourself.
Yeah, so that's a really good example of that feedback loop that I talked about at the beginning, where the brain's taking messages from the body, thinking what's going on here, things have changed, my position's changed, and so it's trying to regulate it for you.
I've got less movement in my left hip than my right hip due to a fall that I had not the summer just gone, but the summer before. And since then I've had a sort of stiffness down that side, which I haven't got on the right side, although I do exercise it fairly regularly.
Perfect. Good. Okay, so your hips are probably a little bit tired now. So what I want to do is to go on to something that involves movement, but it's not going to work the hips in the same way as those ones have. So can we get the band if you've got it, or the scarf if you don't, on the floor? All right, so the next one is you can actually use a floorboard at home for this, but Tricia's floor is a bit, it zigzags rather than going in a long line. So we've got actually got a scarf down on the floor. You could use a band or just something that's long and thin. You just need to make sure that it's not slippy. You mustn't, I don't want you to slip on it. So be really careful what you choose to walk on. So what we're going to do is we're going to walk along this scarf, in your case, with one foot in front of the other. So if you think about how you walk normally, the feet are hip width apart. So what we're going to do is going to ask the body to walk in a different way. So it's heel to toe, and your challenge, Tricia, is to stay on your scarf as you go. Go when you're ready.
So can I have my arms out to balance myself?
It's going to make it easier if you do, but if you need to, then yeah, that's the way to go.
Well, I'll try without. This is the test to see if you're drunk or not, isn't
it? That's exactly it, yes.
So I'm as sober as a judge.
So
do you want me to turn around and walk back?
That looks good. No, what I want you to do is to walk backwards.
Oh, okay.
So exactly the same idea, but this will really confuse the body and the brain. Think, what's going on here? I don't normally have to do this. So it should be much more of a challenge than the one where you were walking to the front. Good. How did that feel by comparison?
Not too bad.
So I'm going to add a little bit of extra. So you can see what I'm doing here is I'm layering on top all the time, just challenging a little bit more, a little bit more, a little bit more. So it's up to you where you stop. But I think Tricia can definitely go a little bit further. So we're going to go on our tiptoes, Tricia, and do the same thing as what you've just done. So what we've done here is we've reduced the size of the base even more. You've not even got a whole foot to balance on. You're balancing on the ball of your foot on your tiptoes. Yeah.
The idea is to do small steps, presumably.
Yeah. So you can see how that's making Tricia wobble much more than the one where her foot was completely flat on the floor. Are you up to going backwards?
There we go. I'm going to go on tiptoe backwards, yeah? Okay, have a go. Am I supposed to have my head up?
You'll want to focus somewhere. I wouldn't worry too much exactly where you're focusing.
I've fallen in the water, everybody.
Good, brilliant. So did you feel the level of difficulty increase as we took more of your base away, Tricia, and then also the forwards versus backwards?
Yeah, unquestionably. I mean, it's definitely a lot more difficult to go backwards on tiptoes and try and stay on the scarf without, as I say, if you imagine it as a plank that you're walking across a river, you don't want to fall in the river. I think I just fell in the river.
And I always think about those wonderful gymnasts, you know, when they do the beam routine. I mean, that beam's something like 4 inches or something, isn't it? Or whatever that is in centimeters, yeah. 10 centimeters, it's tiny. And all the things they're doing on that beam, it's absolutely incredible and a brilliant example of superb balance. Good. Okay, so let's take your scarf away and we'll go on to the last one, which is also showing balance, but in a moving situation. So we're going to get your body to move and then it's going to have to stabilize and balance. Okay, so what you're going to do, you're going to take a small, when I say small, I don't want you to make a great big leap out to the side, but I want you to jump out to the side so that you end up on one foot and hold it there on the one foot. Yeah, exactly.
Okay.
Yeah, good. And again. So it's quite hard when you've gone from that sort of moving situation where you've got momentum and the body's suddenly got to stabilize and stop and balance. Quite challenging. And the bigger you make the jumps and the more movement you get, the harder it will be.
Yeah, it's the whole thing about, I find the balance thing so much easier when you fix point with your eyes, where if you're moving, you've got to it takes time for you to then fix that point with your eyes. So yeah, that's what makes it, that's what makes it harder, isn't it?
Yeah, that's exactly it. Yeah. So we've done that side to side. You can also do it, I think we've done it before, front and back. So you can kind of, and this one mimics almost that thing that you do when if you do trip and you think, oh, blimey, you know, I'm kind of, you can almost see the floor coming. It sort of mimics that. So that idea of jumping forward and then, yeah, stabilizing as you go. Good.
Much harder to jump backwards without.
Yeah.
Yeah. That's actually a good one, isn't it, to practice?
Yeah, definitely. Good, brilliant. Okay, so there's quite a lot of different options there. And I would say the order that we've done them in is the order of difficulty. So it's for everybody to choose how far along the list of exercises they go and then just build up, you know, you build up over time, but do keep a note of how long you're able to do now, because it is really motivating when you see yourself improve. So I mentioned earlier on that leg strength and in particular hip stability is really important in balance. And I talked about that first session that we did on lower body strength, and all of those exercises will be relevant to what we've done today and will help to improve the strength in the lower body. But I thought it would be just useful before we finish today to show you one other really good exercise for that muscle that is at the side of the hip. So it's the clam exercise. You might have come across it. It's a very common exercise and very effective. So what we're going to do is lie down on our side. We can't really do this standing up. So you're going to lie down on your side, and you're going to bring your knees towards the front of the mat, but make sure that your feet are level with your bottom. So your feet need to go further back, Tricia. So what we're trying to create is like a triangle shape. Your feet and your bottom will be level and in line with the back of the mat, and then your knees will come towards the front of the mat. Now, the other important thing with this is that you don't allow the hips to fall back. So you want to set yourself up in a good position to start with your hips nice and stacked. And again, I always like to put my hands on my hip and think about length down through the waist. So if you allow your waist, in this case, Tricia's left side of her waist, to shorten, then that's going to straight away tip your hips. So keep the length through the waist and keep the hips nice and stacked, the hip bone one on top of the other. So from there, we're going to keep the feet together. You're going to take a breath in, and on the out breath, you're going to open up at the knee, Tricia. So it's a smallish movement, and then return. Smallish movement. And as you make the movement, you want to keep that alignment through the hip. So keep going, Tricia. Think about pushing through something that's quite thick. So you can even put your hand now on the outside of the thigh and just apply a little bit of downward pressure as you open up your knee. That's it, so come back in and then press down and open up the knee from there. So just a little bit of resistance from your hand should help you to really feel what's working here. You can see that Trish is doing this in quite a slow and controlled way, which I think is really, really good. Really try and think about the muscle that's working and isolate that muscle, focus on it as you're working. Can you feel the outside of your hip start to get a bit warm, Tricia?
Yeah, I can feel it in my glutes as well. Is that good? This bit
around the back?
Yeah.
Okay.
Bottom.
Yeah, good, good. Perfect. So I would say around about 12 each side. If you can't do that, then do what you can and build it up to 12. And if you can do more than that, then take a break and then do another set of 12. But you want to get to the stage where that muscle in the hip is quite warm. It feels challenged, but you don't want it working so hard that the whole thing just seizes up and it feels awful. So it's really important to listen to the signals that your body is giving you and to really try and work at that point in the middle between, yes, it needs to be challenged, but you don't want to push yourself too far. Good. Perfect. Lovely. So we probably don't need to show both sides, but for everybody doing this at home, you definitely need to work both sides of the hip. It's really important to get the same amount of load on both sides of the hip. Good, brilliant. So I wouldn't, if I was just doing balance exercises on on a normal day, I would not necessarily go through all of the lower body stretches. However, if you have felt that your hips have really done some work from the exercises that you've chosen to do, and particularly if you've added in the clam exercise that we've just done, then I would definitely stretch out your bottom and your outer thigh. And so for that, I would sit on a chair. I know this is the one that you don't like, but it's very good for the hips. Let's put your foot on your knee, take a breath in, and on the out breath, just gently come forward over that leg. You probably won't want to come very far until you feel a stretch in your bottom and your outer thigh area. Can you feel that?
Yeah.
Good. That looked really, really good. And then you'd go and do the same exercise on the other side, then you're even, but we only work one side, so we just stretch the side that we worked, and that's good enough. And then if you can just loosen off really, so shake out, give your shoulders a bit of a circle. Going to ease the body out just to finish off really. So circle your shoulders off. No, we didn't use them very much today, but just nice to get a little bit of extra mobility in the other way. Good. And then you're just going to go from one side to the other. Good job. And then reach down one side and then down the other side. Good. And then we'll have one last big breath in, reach up and release the arms. And there you go. You're balanced.
Thank you very much.
Balanced out.
That was brilliant. Well done. Thank you. And yeah, encourage all of you to do as much balance work as you possibly can, as and when you feel like it, because you know, that's the best way to progress. Build it into your daily life on a regular basis. So yeah, thank you very much indeed, Lindsay, and I shall look forward to seeing you again next week.
Yes, perfect. Me too. Where we'll do some flexibility work next week. So something completely different again.
Look forward to that. Thank you so much.
See you then. Bye-bye.
Bye-bye.